Hello friends, welcome to Creative Medicine. In this lecture, we will learn about combination use of beta blockers and calcium channel blockers causes. So beta blockers will inhibit the heart, okay, whereas calcium blockers also does the same thing. So as a result, they will decrease the heart rate, both of them. So this will progress to heart block. Both of them will decrease the blood pressure, which will result in hypotension in the patients. Because it results in heart rate, this is called as bradycardia. So in beta blockers and calcium channel blockers may cause heart block, hypotension and bradycardia together. Which of the following regarding enalapril is treatment in patients with essential hypertension? Enalapril is actually an ACE inhibitor. Because it is an ACE inhibitor, it decreases the angiotensin II concentration in the blood. Postural hypotension is the common side effect of Postural hypotension is common side effect of alpha receptor blockers. Thank you and thank you for watching.